Slides are visible.
Yes, sir. Slides are visible, sir. F5, sir.
It's okay.
Yes, sir.
So good afternoon to everybody. So we will spend 1 hour on research ethics. Publication ethics will be taken up after I complete. So most of the talk is based on the ICMR guidelines for researchers on ethics. It's available in ICMR website, which you can download. And the objectives of this session will be, one, to know the genesis of ethical guidelines, why these ethical guidelines has come into existence. Describe the ethical issues related to human studies. Then we'll take up animal studies. Then I will talk about the general guidelines for ethics clearance for research studies from the ethics committee, and how to risk stratify your research study, and what are the universal principles of ethics which we need to follow. So you must have heard about this Nuremberg Code of 1947, because it started because of various research studies done, especially in Germany by the Nazis, and they have put the population or the participant into inhuman type of research before the Second World War. Later, many of the scientists were prosecuted because their studies were found to be inhuman. Now, even not only human beings, animals also, you cannot do these type of studies. So first, the Nuremberg Code of 1947 came into existence with the essentiality of voluntary consent they have brought. So nobody can be studied or put into research unless he or she voluntarily gives a consent. Voluntarily, with full knowledge, they have to give the consent. Later came the Declaration of Helsinki in 1964 by the World Medical Association in Finland, and they have improved upon the Nuremberg Code of 1947. This went on with 7 revisions. Finally, we got the Belmont report in 1979. It is by the National Commission for Protection of Human Subjects in Biomedical and Behavioral Research in USA, and this is the basis on which all other recommendations have come. Of course, it has gone through many changes over the years. So UNESCO's Universal Declaration on Bioethics and Human Rights came to exist in 2005. Federal Policy in Human Subject 2017. These are all modified based on the earlier recommendation. Then we had our Indian Council of Medical Research statement on ethical consideration involving the human subject in 1980. These guidelines were modified later, called as Biomedical Research in Human Subject in 2000 and revised in 2006. So you imagine how many times it has gone to revision, because people felt the guidelines given are not sufficient to deal with the ongoing process. Later, the Central Drugs Standard Control Organization, also called CITSCO, they have brought out in 2001 good clinical practice guidelines for clinical trials. When you make a clinical trial, it has to be approved by the CITSCO, Drug Control General of India. If it is not an academic trial, it has to go to the CITSCO. Even otherwise, it has to go to the ethics committee, of course. Then the revised schedule of drugs and cosmetics of 1947 came in 2005. Initially, they talked about drugs. Later, even any instrument or any of the devices which are putting in the human subjects also have to get clearance from the CITSCO before it can be experimented on human beings. So all these have come into the picture. So when you submit to the ethical committee or ethics committee, all this will be taken into consideration. Sometimes the researcher gets upset. They're asking me too many questions, but you see that it is very much relevant, and If the ethics committee gives clearance and it is not in line with the rules and regulations, somebody can even prosecute the ethics committee also. So they have to be careful in giving clearance for research studies. So basically, the value of benefits of research are will depend upon the integrity of the researcher. So every individual researcher has to have good integrity. That is most important. So scientists basically have social responsibility. So the research misconduct and misuse of research will be taken as an offense, and if it is being proved, the person can be prosecuted. So you have to be very careful in doing research which is unethical and problematic. So the researcher should be abide by the standards which set out by the professions, the discipline, and the institution, and the relevant laws. See, if the participant is not satisfied with the ethics committee decision, he has got every right to go to the court. So he can take a research to the court also. So you have to be careful when you do studies. All members of research team are expected to maintain high standards. So it is goes without saying, any researcher should maintain high standard, proper moral responsibility. He should be well disciplined, and he should be in line with the professional and relevant laws. So, responsible conduct of research involves the values, policies, planning and conducting the research, review and reporting of the research, and the responsible authorship and publication. The reviewing of research and authorship publication will be taken by the next speaker. So I'll concentrate mainly on the research aspect. Every institution should have a division of research. It's very important because institution conducting research must have this unit which will facilitate the research activities, manage the grants which the institution may receive, and overall research aspect has to be monitored by the research division. The research office must work along with the ethics committee and other stakeholders, like the faculty members will be there, PGs will be there, UG students will be there. All these have to be coordinated by the research division, and they should have a proper SOP, which should be in place so that all components of the research will be carefully monitored as per the standard operating procedure guidelines. Without trust between scientists and the public and the research team, no meaningful research can be conducted. So everything, otherwise it will be compromised. The research will be compromised. So we have to have good understanding between the scientists, public, and the research team all together. And the researcher should be aware that the resources for biomedical research are very limited, and they are very precious, both the participant and the reagents, money, everything. It should be used judiciously without any wastage. Wherever possible, once the research is over, you should make an attempt to translate the research findings so that it will be utilized for the public health outcomes. So ultimately, why you are doing research, not only finding the problem, finding a solution, then implementing it so that overall health infrastructure or health condition of the public will improve. Now, as you pass through, various contemporary issues will come. That's why the several modifications of the ethical guidelines have come into existence. Like use of underprivileged and vulnerable group as participant. Normally, a teacher not supposed to include his students who has not cleared their subject as per study participant because they are under his care or her care. So what happens here is the student cannot say the teacher that I am not willing to participate because he may think that you may not clear his examination. So anybody under your care, you are not supposed to include in your research activities. So if you want a healthy volunteer, you take group of students who have completed your course. Anatomy teacher can take clinical teacher students like that, some which they have cleared the their subject. And once you complete the research, you should give post-trial access benefit to the society, which I was talking about. A translation or whatever has come out, it should be brought into the public domain, or publication should be done so that it will be used by other people for improving the infrastructure or health conditions. So continuing education of the research is important with the contemporary issues, so that they will also be in tune with the developments. Now, another issue is of mentoring. Mentoring is very important, especially for the initial research worker, like students or a faculty member in early career. So, the mentoring is one of the primary means for one generation of scientists to pass on their knowledge, values, principle to the succeeding generation. So, you transfer your knowledge, skill, and the principle to the next generation. It should be in the right direction, of course. The mentors, through their experience, they will guide the researchers in a way above and beyond what they can gather from textbooks or journals. They will give extra information. They should maintain good relation between the mentor and trainees, so that the trainees should become responsible researchers. So the mentor should ensure the trainees conduct the research honestly. Do not interfere with the work of other researchers. Many times you don't do research, but you don't allow the next person also to do. This is what's happening in many places. You don't want other people to work also. So the researchers also should be used judiciously. A mentor should, of course, should be knowledgeable. He should teach and live with the example. So, and he should also understand all trainees are not same, because there will be individual differences will be there. He should meet the needs of all his mentees, and there should be sufficient time available. He should be available to the trainee to clarify, discuss, debate issues, so that sometimes the mentee may give a good idea which the mentor may take it forward. So a mentor should encourage decision making by the trainees, and the trainees should take active role in communicating his or her needs to the mentor, so that they will get the proper guideline directions. Now, next important issue is policies. Now our VMRF has the research policies, like that each institution should have the research policies. So the institution must establish policies and mechanisms for protection of women research participants. So finally, it becomes the responsibility of the institution. Suppose somebody makes some mischief, finally the problem will come to the head of the institution and the management. So they have to maintain the policies in written, and everybody should follow that. So such policies should assign responsibility to the institution, ethics committee, and the research. All should be described in these policy statements, which should be available. And there should be mechanisms, and monitoring should also be there. So whether the data is collected is proper, whether they maintain properly, and what they are doing with the data and the samples collected, all these have to be monitored. Normally, the institution believes the researcher, they are doing everything in the right direction, but sometimes complication may arise if you are not careful. So policies can be made available in the website of the institution or organization, so that everybody knows what are the policies and guidelines to be followed. The researchers also should follow their respective professional code of conduct, because our professional bodies also would have given some guidelines, what has to be good, what is bad, how it should be done, that have to be followed. Am I going very fast? I think all of you will be knowing all this, but it's only a recapitulation and also stressing some important issues. Now, ethical risk stratification. This is different from actual research to the participant. So, ICMR has given 4 levels of ethical risk. Now, some of the studies are considered as less than minimal risk. Here, you can ask for waiver of consent from the ethics committee. So you cannot do a research even on a retrospective data without ethics committee clearance. So you have to submit to the ethics committee clearance and tell why you need waiver of consent, and ethics committee will discuss and approve. So if you are doing anonymous data, in the sense even case records with the individual details, you cannot study without the individual's consent. It has to be anonymized, in the sense somebody else put a code number and give you the data alone, which you can analyze and publish. Similarly, comes to the material collected, like you might have collected the blood sample, you might have collected the tissue sample, but you cannot store them without the consent of the participant. The participant, you should tell, I am going to preserve this for 1 year or 2 years. I may do another study using this. But before doing the study, I will take clearance from the ethics committee. Without that, I will not do. So the either patient, participant or patient signs, then you can preserve. Otherwise, you have no right to preserve somebody's biological material without his or her consent. So it has to be discussed when you are collecting the sample itself. Now, this is called less than minimal risk, where you are not going near the patient at all or participant at all. You are only taking the data from the case records or anonymous tissue samples or biological sample which have been preserved, you use for research. Now, next comes the minimal risk. Minimal risk, actually in real term, there is no risk at all, but ethically they are considered as minimal risk, where the probability of harm or discomfort to the participant is no more than routine life. Yeah, like going to school, going to the college, or going to the market, something may happen that is beyond the control of anybody. Like if you are taking history from a participant or talking to a participant, you are conducting physical examination. You collect the body fluids without invasive procedure like urine, stool, saliva. You cannot involve the patient or make him in discomfort in a minimal risk research. So this is called minimal risk. In the mean, there is actually no risk than routine your life, routine life. Now, next comes the minor increase over minimal risk. That is the next level, or this is also called low risk. So the discomfort will be little more than what will happen in your routine life, or less than the minimal risk. The research on children who cannot give consent on by themselves, or adolescent where the parents also or the guardian has to give consent. Women and newborn babies or individuals with special needs, they are come under this minor increase or minimal risk. Similarly, collecting blood sample or some other sample which you may do for routine investigation will also come under this category. Now, next comes more than minimal risk or higher risk. All intervention studies will come under more than, or you are removing more blood sample or some sample more than what you will be doing for routine investigation will come under more than minimal risk. So don't confuse with the ethical risk with the risk to the patient. They are basically classified into less than minimal risk, then minimal risk, minor increase or minimal risk, and more than minimal risk or higher risk. Is it okay? Now, next comes the important issue of informed consent. Every research should take informed consent from the participant. This is very, very essential. And that's why they are always asking, where is your informed consent information, patient or participant information sheet? Where is the consent form? Every ethics committee, they will ask. So they have to be submitted by the researcher what actually they are going to tell the patient or participant and how actually they are taking the consent. This procedure has to be clear to the ethics committee before they give approval. So informed consent is an essential part of human research. The process to be approved by the ethics committee. Normally, video recording of consent is not necessary for academic research and non-regulatory trials. But if it is a regulatory trial, the CITSCO will insist on video recording of your consent also. When you are talking to the participant, you have to record, and that should be made available for scrutiny. Whenever they ask, you should be able to show that, not that you will just record and wipe it off. Information given to the participant should be in simple words, without using medical language, simple words, and it should be in his or her own language. That's why they ask, where is the Tamil form? So you should have an English form, you should have a Tamil form, depending upon the participant, you should give either the language. The consent should be taken from the study participant without any coercion or any pressure. If participant cannot take an independent decision, like an unconscious patient or a young child or mentally with special needs, the legal guardian should give the consent. But sometimes you may have illiterate patient who cannot read or write, then you should have a neutral witness who will be able to understand what you are going to talk or show them. The researcher should also verify whether really the participant has understood what he is telling them, or he say, okay, he signs. Then for what he signs, he doesn't know. So this should not happen. The consent should be voluntary without any inducement. That's why there was one question whether all research participants should be paid. Normally, you don't pay the research participant unless he has come only for research purpose. If a person has come for your research purpose voluntarily and he has lost weight or he has spent money for coming, the transport, they have to be reimbursed by the researcher. So any loss due to your research should be reimbursed. But if a patient you are recruiting from the hospital where he has come for treatment, the treatment will be free, but he will not get any other remuneration or money per participant. And every participant has got a right to withdraw at any stage of your research. He can say, no, I am not interested, I am going now. He can walk off without losing any of his privileges. Suppose you are giving a treatment. If you go, I will not give any further treatment. You cannot tell. Your treatment has to continue irrespective of he continues in your study or not. Any research-related injury has to be compensated. The compensation will be decided by the ethics committee depending upon the serious nature of the injury which you have caused, and the compensation has to be paid. And the ethics committee will decide it is related to your research or not research. Sometimes some injury may occur but may not be related to the research. Like a patient you are talking, he slips and falls down, he gets some injury. If it is during the time of your research, you have to give him free treatment. You cannot charge him for any treatment if it occurs during the time of your research. So, financial compensation be given if there is any financial loss because of the study. So, that is one of the questions which was there in the test. I think you would have answered correctly. So, all research persons need not be paid money. But if there is a loss because his participation in the study, it has to be suitably compensated depending upon his wage for the day, his transport charge, his meals, everything has to be taken care of. Now, animal experimentation. Animal experimentation is more difficult than human experiment now because lot of regulations have come. You cannot conduct, take animals and inject some drugs and cut them and see. It cannot be done. You will be put in the behind bars. So those involved in animal experiments must follow the existing regulation and guidelines. Prevention of Cruelty Animal Act 1960, which was amended in 1982. Breeding and Experimentation Rules on Animals 1998, which is amended in 2001, 2006. So various rules have come. So guidelines for care and use of animal in scientific research by the National Science Academy was done in 1982, which again amended in 2000. Then ICMR guidelines on human care and use of laboratory animals came in 2006. Later, the government has made a committee, the Committee for the Purpose of Control and Supervision of Experiment Animals. This is also called CPCSCA. it gives all guidelines how the animal experiment is conducted. Half of the animal ethics committee members will be from outside, nominated by the CPCSA, and only the internal members will be nominated by the institution. And they have to send the report after each ethics committee to this CPCSA, and also their duties look after the animal lab, whether their proper water supply is there. They have to be given RO water. These animals, you cannot give water. You may drink tap water, but animals cannot be given tap water. You have to give RO water. They have to be given proper temperature. They have to have AC. Temperature should be maintained between 22 and 24 degrees, and it should be very clean. Their feeding should be clean. All this has to be monitored by the animal ethics committee members whenever they come for your meeting. So they also have a responsibility, and the report has to be sent to this CPCSCA from time to time. If you find anything problematic, they will remove your license. Then again, you have to go back to your license. So now, planning and conduct research some specific issues. I will go in some details. One important issue is conflict of interest. So the conflict of interest arises in many research activities. So it is a condition whereby the professional judgment concerning the primary interest, or such as the participants' welfare, the validity of research, either perceived or will be influenced by a secondary interest, which could be financial, which could be personal, which could be academic, or sometimes political. So all these conflict interests may come into the picture. Although scientists are beyond all these, there could be outside pressure on you. So they have to be taken care. So what happens is, once the conflict of interest is there, it may influence the choice of the research question, the methodology it may influence, it may influence the recruitment of participants, retention of the participant, interpretation, publication of the data. All these things will come into picture. So you have to be very careful. There is no conflict of interest. So in our SOP, we should have develop and implement policies and procedure to identify and reduce and manage if there is a conflict of interest. What we will do is identify a conflict of interest. So ensure that all documents, including the conflict of interest, like financial support you have received, whether the trial has been given by a drug company, all these have to be disclosed to the ethics committee. So ethics committee members will discuss and decide whether the conflict of interest is major, minor, whether it can be allowed or not allowed. All those things they have to discuss and decide. So prevent intellectual and personal conflict by ensuring when you are reviewing, the person who are involved should not be part of the decision making. Suppose if my project is there, when I should not, even if I am a member, I should rescue myself. I should not participate in taking the decision. Similarly, your relative, your close friend, somebody submitting, you should rescue yourself while taking the decision. So evaluate each study in the light of any disclosed conflict. Sometimes people may not disclose later. People may find there is a conflict of interest. You can be questioned and you can be penalized for that if you do not inform the points. So require the members to disclose their own conflict of interest also. Not only the researcher, the members also should tell what is their conflict of interest in a particular research study, and we should take appropriate steps to mitigate that, how to avoid this problem. And next is collection of data. There is no best way to collection of data. Different collection technique can be used. You may use a computer, you may use a hard copy, but somewhere it is properly recorded. The research should be sensitive to the participant and use the best practice to data collection, because data is very important. Today you collect data from people, waste their time, and you waste it or you lose it somewhere by fire or accident or something happens. Then the whole thing is wasted. So it should not happen. So the data collection involves physical process of recording the hard copy, soft or electronic copy, whatever that you have to take care. So every time you better to keep a physical copy, even if you are doing electronic version of data recording. So it should be valuable research data must be properly recorded. There should see that there is no accident, fire accident, or and especially if you are taking photograph or interview recordings, it should be properly confidentially should be kept. It should not be given to somebody else without a permission. Now, next problem comes research funding. So, institutes receiving research funds have the responsibility to spend the budget, regulate the compliance and management of the collected data funds. You should send a report. That's very, very important. Whether it's a seed money or external funding, the research has the responsibility of spending judiciously, submitting all details of how he has spent, and submitting the final report. This means that the researcher should obtain appropriate permission approval to take their data and funding to another institution if they are going. Suppose if you already declared, you may go from one place to another. There are people who may shift from one place to another. Directly you cannot take because the research is given to the institution, not to the individual. By being an individual working in the department, you get the research project. But you cannot directly take wherever you go. It is not your project. So if you have to pay the agency which is funding, the head of the institution where you are working and where you are going to work, all have to agree. Then only you can transfer from one place to another. It cannot be done directly. Otherwise, it belongs to the institution. You leave, it goes with to the institution. You have to just walk off. So the ownership and responsibility need to be carefully worked out before the data are collected. So you should tell what is my role, what is the institution role, what is this role, and it has to be approved. The researchers should ensure clarity about data ownership, publication rights, obligation, all these things have to be discussed. Sometimes the issue of publication comes, who is the first author, who is the second author, who is the corresponding author, all these issues come. This has to be settled when you are submitting the research proposal itself so that tomorrow there is no confusion with what is going to happen. And if there is any college or inter-institutional, international collaboration or something, they should have proper MOU and it has to be approved by the ethics committee. Now, sometimes the problem will come with biological sample. Biological sample belongs to the participant. So he has every right on his biological sample. He can say that I want to take my biological sample and go. I don't want you to keep it with you. He can tell. But suppose sometimes it may so happen that if some biological samples are removed, your research output may collapse at the end. Suppose in subsequent research you do. So you have to take a written statement from him. We are going to preserve your this biological sample. We may use it for another research. When which case we will take ethical committee. Once you are given to us and we do the study, you should not withdraw. So that undertaking you should take beforehand. Otherwise, he can come anytime and say, give my sample, I am going. So institutes hosting the research and implementing the research are the custodians of the data and sample which they have collected. Both are responsible for it. Research must be conducted using the appropriate and reliable method, because if your method is wrong, if you are not used a proper technique, whatever you have done is a waste. Now, need for authorization. When all you require authorization. Suppose you are including human participant, obviously you require authorization from the ethics committee. If you are doing animal studies, the animal research ethics committee has to give approval. If information posted on the website, unless it is for public, you have to take permission. If you are using hazardous material like radiation material or some biological material, which or this coronavirus sample, all this you have to handle only with you have to have prior permission. There are particular committees for each one of them, the government agency, which will give you clearance. So biological sample storage, future testing, all has to be tested. You have to have a biosafety committee to clear those type of things. So information you take from another source like database, libraries, for everything you have to take permission. When you otherwise it will account to plagiarism. Data protection and storage is important. The data or whatever research you get is confidential. It is between you and the participant. And when you publish, you don't send blood sample of Muthuswamy or Kandaswamy. You say that the particular participant age, this, male, female, all those things you will say. You will not tell about the individuals. If any individual's disclosure has to be done for any reason, you have to take separate consent for that. You cannot divulge anybody's personal interview in any publication unless you have taken his permission. Similarly, photographs. Photographs identifiable cannot be published without prior permission from the ethics committee as well as the individual. The individual has to sign. Okay, you publish my photograph, I have no objection. So if you have to reanalyze also, you have to take permission from the ethics committee. So responsible data handling begins with the proper storage, protection from accident, fire, theft. All these things are responsibility of the researcher and the institution. So you should be careful. There will not be fire accident or other catastrophes, flood and other things. It should be carefully kept in a place, safe place. Anything can happen even if it is safe, but you should take enough care. And always better to have a backup for your computer data because sometimes computer gets virus or something, everything may become wasted. Now, when you review and report research, I will not go into the reporting or research, but when you do the review and when you want to report, irrespective of the result, whether it's positive or negative, sometimes you may think this medicine will work, but it may not work. Then you have to say it is not work in your study sample. So whether it's positive or negative, you have to publish it. This is one of the questions, whether negative study can be published or not. Negative or positive, it should be published because it will be an experience for the next person. If it is not working, why he should waste his time on doing that? And it would be unethical to expose another set of participant or patient or volunteer to the risk which their own group has already undergone. So you should not repeat a study if it is already proved not working or it is very well working. Now, research misconduct, policies of misconduct. This is also a very important issue. So, research misconduct comes with fabrication of data. You don't get the data, so you change the numbers. Falsification, you show the wrong wells recorded wrong. Or plagiarism data, somebody else has done study somewhere, it just copies data. Which are all serious issues which not only occurs in India, but everywhere in the world. But one should be very, very careful. That is why sometimes they will publish. After some time they'll say, I'm sorry, I am withdrawing the paper. So they will withdraw the paper. But it does not end there. They can take action against the misconduct. So research misconduct, if suspected, needs to be investigated. The head of the institution cannot sit quiet, nor the ethics committee. Once it is brought to their notice, they have to investigate. The investigation has to be done timely, fair, and transparent. Sometimes some people may complain. Just he does a lot of research work, so let me complain. Let a full stop to his research. That's what I said. Some people will not do work, but create problem for others. So it may be true, it may not be true. But the institute and ethics committee should investigate even if they complain and record it, whether it's true or not, what was the finding, all this. The research should be made public in the public domain so that people do not have confusion. Now, next comes registration with the clinical trial registry of India. So, always we ask whether you started registering the clinical trial registry of India. Now, there is clinical trial of registry of India, CTRI it's called. The website is there. It is a free. It is connected to the WHO registry. Our Indian ICMR is maintaining this CTRI registration. It is free and online public record system are available. Why it is important to register the clinical trial? Because some of this treatment which you are doing may be rare. Some patients may reach this situation where they are helpless, nothing can be done. So somebody says, I am trying this new. So they can join the research. If some benefit they get, it can be used. Secondly, if somebody is doing then you should not repeat the same study in another place. So it should come to the public domain. That is the idea of registering in CTRI. So the SID score, our Drug Control General of India, they have made it mandatory from 15 June 2009. All drug trials which are come under the Drugs and Cosmetic Act should be registered with clinical trial. You cannot conduct a research without registering the clinical trial registry of India. But if it is an academic research, it is voluntary now, but it also better to register because most of the major medical journals do not accept publications related to unregistered clinical trials. So they will say that have you registered? What is the number? When you are registered, they will check in the website whether it is registered or not. Then only they will consider for publication. So it is very important you put in clinical trial registry of India. Next issue comes with the collaborative research. You may have collaborative research because it becomes important because you may have some equipment, some expertise, whereas another person may have expertise and equipments in another way where you can utilize, make a collaborative research. So it may be inter-department between the department, the same institution, or inter-institution, or something international. But whenever multi-center involving public or private research agency could be there, but you should have a MOU, Memorandum of Understanding, for whatever research you do. So the main ethical issue surrounding this collaborative research comes under in relation to the material and data collected. Who will keep the data? So this has to be specifically told who will keep, who will author, what they will do, what publication they will make, and the research findings, who are the co-investigators, any conflict of interest, how to commercialize. Suppose any discovery you make, how to commercialize, who will get the share, what will be your share. All these have to be discussed when you undertake the research. So collaborative research studies should take into account the values, benefits expected from the research, compare the risk involved in the person or population. So your ethics committee will not give you clearance if committee thinks that the risk for the participant and the patients will be more than the benefit you will get. They will say, no, we cannot undertake this. So the participating center should function as a partner and a collaborator, not just a place for collecting samples. Many times what happens, the Western country, they cannot get ethics committee clearance. So they will come to India or some other underdeveloped countries or this developed country. They will say, oh, I will give you money, all this, I will fund everything, I will bring a lot of this thing. You become a partner. So you say, okay, fine, because you are getting name, money, everything. But the issue is to carefully take. If the knowledge and bilateral, the flow should be both sides, yours and theirs should be bilateral. And you cannot work like a under partner to another person from a developed country. So the careful consideration should be given to protect the dignity, rights, safety, and well-being of the participant. That's very, very important. The institute and the ethics committee has got the responsibility that the participants and patients are not put into any risk or any problem. So the nature, magnitude, probability of a foreseeable harm resulting from the participation in a collaborative research should be specified, and it should be discussed with the participant. The participant should agree, these are the risks, are you agreeing or not? The benefits and the burdens should be equally distributed. You cannot be put too much burden on you, but the benefit you take, it cannot happen. And all participants in collaborative research should have access to the best nationally available standard of care. And if there's exchange of biological material, sometimes you may have to send the biological blood or tissue sample to USA, UK, or some other place where you are doing collaborative research. You should have a material transfer agreement. This has to be approved by the ICMR committee for approving this. You cannot send out of the country any blood sample or tissue sample without permission. So Complaints related confidentially, sharing out data, joint publication, benefiting all should be addressed when you are submitting the research protocol. During conduct, the review, monitoring of the collaborative research, somebody should oversee that is going in the right direction. The EC and the ethics committee should review the protocol with the social context of the place. Suppose if you are allowing India to be used as a study center, Indian culture and values should accept that is okay. Otherwise, you cannot allow a research study to be conducted. So a mechanism for communication to the ethics committee also should be established so that they take a joint decision. If any conflict occurs, the local ethics committee has got every power to stop the study. If they are feeling that you are causing damage, they can immediately ask you to stop the study. You cannot continue the study if there is any problem. So the EC or ethics committee should examine whether the researcher has the required expertise and training in the area of collaboration. This is very, very important. You may ask why they are asking my CV. So the ethics committee should know what you have done so far, whether you have the requisite knowledge and skill in that area or not. Otherwise, they will not permit you to undertake a study. So if an unqualified person or improperly trained person cannot conduct a research. And participating researcher from collaborating side should be adequately represented when designing the research. So sharing of the benefit also should be between the institutions. So it is not that you will take the burden and disappear, but you should also get benefit, and this should be mutually acceptable. So the international scope of the international collaboration in biomedical and health research has gained momentum because of these issues. Because well-developed countries, they cannot get ethics committee clearance ECD for some study. They will try to divert into the underdeveloped or developing countries. So while one should collaborate with the other countries and other people for improving the knowledge, we should always look at whether we are getting exploited by these research experiments where our people will be used as animals for research. It should not happen. So you should be very, very careful in accepting any research from any other country or center without going through the pros and cons. So to undertake collaborative research in India, our country's ethical guidelines, relevant regulatory requirements have to be followed. It has to be cleared by the our ICMR center, which has got the power to clear or not to clear. So you have to apply and get clearance for international studies. There should be a good communication between the international participant center. In any of conflict arises, the decision of the ethics committee of India or our country will prevail. We will decide what has to be done. So the institution and the ethics committee have to protect the researcher against ethical imperialism. We should not allow ourselves to be working under them. It should be equal. The institution ethics should not accept international proposal which cannot be done in their own country. If you are convinced that it cannot be done there, you should not accept it. So all biomedical and health research proposal involving foreign assistance should go through this health ministry screening committee, which is under ICMR. So you have to apply and get permission. Without that, you cannot undertake any collaborative research with the foreign countries. And export of biological material also, you have to take permission. You cannot send the biological material outside the country without clearance. Both ethical committee and regulatory approval should be there. But we should be very, very careful. So exchange of biological materials, you have to have, as I said, material transfer agreement should be there. All related issues have to be settled before you start study. Now, why ethical issues are very important in research? Because basically we are looking protection of the study subject. The research should have interest of the individuals, groups, and the society. Research is secondary. The individuals or the participants The interest is primary, and protection of the confidentiality and informed consent, you should always take care, especially the vulnerable section like children, as I said, pregnant and sick patients, those with developmental cognitive or institutionalized individuals, homeless and vulnerable. These are called a special risk group. They have to be given special care. The basic principle of ethics is do unto others as you would like them to do unto you. So whatever you don't expect any other person to do, you don't do on them. So first you ask question, if I am a participant, I will allow injection, this medicine, this thing. If the answer is no, you cannot conduct that study. So I will just conclude by this universal principle of ethics. All of you may be knowing. So autonomy is one of the most important thing in any research activity, or one of the most important universal ethics. Every individual has got a autonomy. You cannot invade his autonomy. So that's why the informed consent. You have to talk to them, make them understand. Then the permission is voluntary. It should not be coerced. And always beneficence or benefit of the patient should be uppermost. If you think your research will cause harm, you should not do. So always think of good to the patient, no harm. Non-maleficence. At no cost, you should do harm. If you knowingly do harm, you are punishable. Justice and equality. This is very important because everybody is equal under law. So that irrespective of the color, caste, creed, and social status, everybody will get equal type of treatment as far as research is concerned. So basically, you have these four principles of universal ethics: autonomy, beneficence, non-maleficence, justice, and equality. And I think I have completed in 1 hour, 1 minute less. So you can ask question. Actually, I started 2:10, so I've taken 51 minutes. Any questions, anybody? You can put in the chat box or you can ask. I might have been a little fast because there is so much material to talk, but I have not gone into individual items. Each one can be 1 hour class, like taking a informed consent or talking about universal principles of ethics. Each one can be 1 hour session. Any doubts, clarification, anything anybody wants to ask?
Sir, in fact, if doctors have got these things, certainly they are more preferred. Otherwise, I have few, whether you call it observations or layman's questions or whatever it is. First thing is, first let me compliment that it's a very comprehensive and very informative talk, starting from mentor-mentee to at the end you have given some 4-5 very important guidelines for ethics, which are very important. Just I want something as a researcher and as a non-medical person. So, for example, you are conducting a research, and he comes to ethics committee telling that he wants to conduct this particular test on 25 animals. I mean, 25, same number, same animal, 25 numbers. And researcher feels that, and ethics committee gives clearance for 25. That is so-called sample size. And I, as a researcher, feel that I will get a better, more authentic data if I do on 50 animals. Is it unethical?
See, I will answer your question. See, number one, human ethics and animal ethics are two different committees are there. And even animal study also, now what they do is you do a cell study, cell culture study before you come for animal study. Because same thing, what they can study by sacrificing animals, many of them can be done with cell cultures available. You can buy the cell from companies and you can do the experiment. If you get a positive result, then they say you come to my request for animals. Regarding the number of animals, you just like human studies, you have to calculate the sample size, what will be required. Normally, animals required will be much less than human beings. They will require for each group maybe 6 or 8, maybe maximum 10, 12 like that for each group. So if he is justified, if the committee, which consists of scientists, many veterinary surgeons will be there. So they are convinced that your research needs so many, they will approve it. But they have to justify, because the report has to go to the Central Animal Ethics Control Committee there. So which will...
Your animal ethics committee's decision is final?
Yeah, for that research, it is final, but if they have, it can be reviewed by the Central Committee also. So they will also be careful. They will, while giving permission, but if you can justify, you need 100 animals also, they will sanction, depending upon the type of study and what you want to do.
No, I have. I'm looking from researcher point of view. Is that, say, for example, when you go to an hospital, they do a biopsy, and they have given the result to the patient, and I'm making it completely confidential, impersonal. All the same biopsy piece, I use it for some other research purpose. Is it unethical? Why? I'm contributing to the welfare of the mankind.
No. Yeah, that's what I told you. When you are taking the informed consent, you are telling for what purpose you are using. And if you are going to use it for another, you have to declare that I will preserve the rest of the sample with me for 1 year, 2 year, whatever time. If I am using, I will again go to the ethics committee and take clearance. I will not do without consulting the ethics committee. He has to take written consent from the person who is giving
but knowing the psychology of the people, do you think that people will so easily agree? They'll say that you are taking a much bigger piece than what is required. That is why I will not accept it.
No,
And even otherwise also, if they take also, the patient may not be knowing.
No, patient not knowing, there are other people watching, no?
No. What I'm saying is, I'm looking from the research angle.
Watching what I'm doing. So they will comply to the ethics committee. Somebody else will be watching you. It is not that in an institution you will go unnoticed, maybe for some time. After that, sometime people will find out what you are doing.
No. One is ethics, sir. Another is ethics. If you stretch it too much, research is going to suffer. So, for example, I'm taking few ml of blood for a particular test. Which patient has come forward? I'll take 2 more ml of blood for some other test.
No, you have to justify, and the ethics committee should get convinced that yes, you need 5 ml, 10 ml also, no problem, provided the person has got blood. Suppose it also depends upon the size of the person. Suppose a newborn baby, they may say maximum 2 ml you can take. Child may 5 ml, adult 10, 15 ml also you can take, they'll say. So it depends upon the participant, and also for what you need, you have to justify.
I mean, obviously, I have a research problem. And I'm ready to justify. There is no doubt about it. What I'm saying is, we are putting too many restrictions on the researcher by this sort of thing. That is one thing. Anyhow, I think debate will continue at the end. And one more thing is, when we are doing a collaborative research or international research, some part of it in India we'll do, and some part they may do, or in some animals we do, and some animals they do. In one particular slide, you mentioned that Indian agencies like CSCA or CPSCA, those things will be sufficient. Similarly, that fellow will take from his country, or their guidelines are also we have to follow.
The responsibility lies with the institute and the institute ethics committee. Suppose if he wants to do in Washington, he has to take clearance there also. We can take only, give consent only for Indian part, for AVMC or whichever college the person is doing. So each institution is responsible, the ethics committee is responsible for their research. Suppose some mistake occurs in USA, you cannot put some guidelines from here. So they have to look after themselves, but bilaterally they should decide what they will do, what we will do, submit, and our part we will clear, provided the committee is satisfied. As you said, Sometimes researcher may feel their ethics committee is putting too much restrictions. But it is not true because they have a legal responsibility. Suppose if we clear some ethics research project which is unethical, they can be questioned. The ethical committee also, committee members, they can be questioned. The chairman and the members are responsible for the decision. So that
So for example, if they do any so-called unethical thing, is the researcher responsible, or ethics committee responsible, or institute responsible?
all are responsible. So what happens
I mean,
is,
is it a crime or punishable under imprisonment and all these things?
no, first ethics committee will decide whether he has done beyond what permission given or any issues arise. They will decide. And if it is a simple thing, they will try to compensate and settle. But if the person is not satisfied, he can move the court of law against the research and the institution. Then whatever the court decides, that will be the decision. See, ethics committee can give internal decision, but it is not completely binding. The person can go to the court also.
No, I understand. I understand. Ethics is extremely important. There is no doubt about it, and especially when we are coming to whether a human or animal is important. But in the process, are we not putting too many restrictions on the researcher?
Yes, to some extent you are right. I am member of ethics committees also, and I am a researcher also. So I understand when I sit on the as a researcher, I feel they are not listening to me. When I am sitting on the other side, other person is feeling I am not listening to them. So either way, it happens. You have to live with the situation because you are put in that position.
No. So for example, maybe I'll take a non-medical example.
Otherwise,
Just last 1 minute one. So for example, a BSc student is going to a chemistry lab, and acid falls on him. I mean, it's an accident. I mean, here no ethics is coming into picture. Nobody is held responsible.
No. If it is included human ethics and he is a volunteer, even it falls by accident, he has to be compensated. Compensated means he has to be given free treatment. But if it is done intentionally, or it has happened out of
What I'm saying is students too conduct the experiments. Na? When they are doing the experiments, it does happen that it may spill.
See, animal experiment, human experiment, a lab experiment. A lab experiment does not require ethics committee clearance. So that is beyond the ethics committee. Whatever mischief he has done, he has to pay for it. Whereas human volunteers involved, human ethics committee will take. Animals are involved, animal ethics committee will take. Other experiments are not there. Like your engineering college, you may do so many experiments on machines, which will not come under ethics. Only when you bring the machine, put it on the patients, then the ethics committee comes into the picture.
Thank you, sir. Thank you, sir. And, I have many other questions, but when we meet face to face, we'll discuss.
Sir, thank you very much, sir.
Thank you.
And we have a couple of questions in the chat box. Shall we take it now, sir?
Yeah, if it is very short, we'll take up. Otherwise, because next speaker should not be delayed. No, you can tell one or two. We can take up anyway.
This is a question from Dr. Rajesh. Is it possible to expect any relaxation in clinical trial rules if I carried out the research in an animal model that resembles very closer to the human in vivo condition, such as patient-derived xenograft models?
No, I didn't understand the question. Clearance for?
Is it possible to expect any relaxation in the clinical trial rules if we conducted the research in an animal model that is resembling very close to a human in vivo condition?
Exactly, that should be the routine practice. The Human Ethics Committee will not give permission till it is cleared in the animal studies first. So first they have to conduct the animals. They have to prove it is useful. Then they will do on a small sample. This is called phase 1 trial. Then they will do a medium size participant. That is a phase 2 trial. Then they will go to the phase 3 and 4 trial. So all clinical trials first have to be done in animals only. Without that, they cannot go directly jump to human beings. So animal studies is a must before any new drug or anything comes to the market. That's why it takes about sometimes 7, 8 or 10 years to put a drug in the market.
The second question is it mandatory to conduct clinical trials if a drug combines 2 to 3 bioactive compounds derived from naturally occurring or herbal resources?
Actually, natural products come under different things because it will not come directly under the allopathic system. So they have a different system, but anything which has to be administered to the human beings has to go to the DCGI, Drug Control General of India, the SIDSCO, which I was telling. There is a specific committee which has to give clearance. Okay, you can use all this in human beings. So they will ask for data where it has been used. In old, some grandmother might have used or somebody might have used, and they might have given by some people who are taken might have become better. So they have to be convinced, then they will give permission. Actually, normally allopathic medicine or allopathic content only, human ethics will take other things. It has to get clearance from the drug controller or they will refer to drug controller. Even you submit to human ethics committee, they will say, you submit to the DCGI, get clearance and then come.
Just
Only
to add
more
on your point, recently Patanjali, you might have heard, Patanjali had come out with some particular medicine for COVID. He was asked to go to the controller.
Yeah, so they have to go, but you may do anything. Sometimes you may get, suppose some patient after taking your medicine dies, he will definitely file a case, say that this medicine only killed him. You might have died of corona, but you may say that your medicine killed me. So you have to be very, very careful. That's all now.
Yes, sir. That's it.
Ah.
Yes, sir. That's it for now. And thank you, sir, for the elaborate and practical aspects of ethics.